Thank you, Chairman. I would like to spend a few minutes to talk about the Green EP Lab protocol used for AF ablation in China. Mm, yeah, China, the whole population is getting age. It's aging population. More and more patients getting older and older, and more patients suffer from AF ablation, AF atrial fibrillation, and our of the case volume for ablation, it's very full. This is floor. It's a EP lab. At the midnight, the light is there as so it's very busy, and with floral, actually we suffered from like a body pain. This is a survey among our Chinese interventional cardiologists who were in lead gown. And so the efficacy and the safety of zero fluoro EP lab it shows effectiveness and safety, the clinical outcome. It can, but the on condition of standard training. So with ICE guidance, the success for transeptal puncture are very accurate and very safe even after hybridization. And this is according to the one literature, the hospital mortality after using with the ICE guided procedure reduce the hospital mortality reduced 8%, and the complication reduced 52%. And patient, the experience in zero fluoro EP lab is quite good. They are very satisfied with because no TEE. In China, TEE is usually done without sedation, without propofol. So, and it also causes like fever, like that, some fever because miss aspiration due to aspiration. We usually do, in the past, we do the TEE just the same day, before the procedure. And this is also without a lead gown, we reduce the operators will have less of experience of fatigue or orthopedic injury caused by lead gown. And this is mentioned by Dr. Pu in last year. FDA approved the zero fluoro AF ablation in the United States, and with the 3D mapping system and ICE, it could provide a good tool to develop zero fluoro EP procedures. And let me talk about something about happened in China. This is a lab in our hospital. We set up a EP lab without a DSA machine. And this lab is close to the usual lab, which is equipped with the EP DSA machine. And before the procedure, we do pre-procedure access patency assessment, like femoral vein patency, to make sure the femoral vein is accessible to the right atrium. And we also check the pericardicentesis when it is needed during the procedure for possible pericardicentesis. Sometimes patients actually, the usual needle is not long enough to reach the pericardium, pericardial space. So we need to do the pre-procedure preparation to measure the distance and measure the determine the direction to do the puncture. And use ultrasound-guided femoral vein puncture, which by which way we can administer, we can heparin can be given before the puncture, because so this way we can shorten the time to measure the ACT. And we also use electrified J-wire transceptor puncture guided by ice, which is very accurate and safe. Especially in the with PFA, in patients with a small left atrium, we needed to puncture lower and anterior of the fossa. And with PFA like Veripos, we can use ultrasound film, and also use the Veripos with a 3D mapping system, CATO, to make sure the lesion we created, to make sure all these the carina and the atrium are involved. And combined with the bubble indicate the degree of contact, and with also with ice to make sure the contact is good, and to make sure the durability of the lesions. And this is the workflow of zero fluoro PFA ablation. Patient come in without the TEE, with directly using ice to check clot in the left atrium, and then to transcept puncture. And before this step, heparin is given, and then do ultrasound film, and then we do ablation, and do complication monitoring, and the procedure done. So the ACT measured before delivery is first application of energy, and to make sure ACT level is above 350 seconds. And this is the overview of Green EP Lab. Green EP Lab is a zero fluoro EP Lab without a DSA in our hospital. Totally, so far, we have done over 4,000 cases zero fluoro ablation, but we had two cases with nightmare. Patient developed into tamponade because of transeptal puncture failure, and because of the patient with paroxysmal atrial fib, left atrium is very small, and actually the puncture done by young physicians who initially the wire, guide wire is in the ASPV, but when they advancing the sheath, maybe the wire jump into the left atrial appendage and result into perforation of the appendage. And this is just a paper. It's a multi-center practice of non or minimized fluoro ablation of paroxysmal atrial fib in China, published in JACC Asia. And actually, we compare the traditional approach and minimize the fluoroscopy approach. It's non-inferior. The success rate is almost same, just as Dr. Paul said, mentioned just now. And in China, the CHS promote the method of non-fluoro approach in the EP lab. This is trainings, and we assess operators to their ability to perform zero fluoro technology. And in last year, from last year to now, 11 training courses have been completed nationwidely, and totally 482 operators received training course, and online training more than 2,000 click. And this is so far 60 centers with the zero fluoro EP lab. EP lab are established in China, and more 240 operators are certificated by the CHIS for with zero fluoro if physician. And this is the ongoing RCT comparing without DSA EP lab and the DSA EP lab. And the total number is 724 patients. Now almost 250 patients are enrolled. And this is participating centers across the China, 16 centers involved. And this we also established standards for zero fluoro EP lab constructions and techniques. And this summary, I think zero fluoro is a very it's feasible and safe, and it's good for operators, but and the success rate and the safety is acceptable. That's all. Thank you.